So, let's proceed with number 77. Number 77. Paracetamol is an aniline derivative. So, paracetamol is an aniline derivative. So, aniline derivatives are generally used as analgesics. So, which is based on the discovery that aniline has antipyretic properties. So, aniline has not only has analgesic properties but also has antipyretic properties. So, the hydroxylated anilines, better known as aminophenols, possess strong antipyretic and analgesic action, and the acylation of the amine group provides N-acetyl para-aminophenol, that is your paracetamol. So, traditionally, your paracetamol is known as your acetaminophen. So, chemical name of your paracetamol is your N-acetyl para-aminophenol. So, primarily, your paracetamol is used in the treatment of as an analgesic and as an antipyretic. Okay. 78. All of the following are progestins except your testosterone. So, progestins are your progesterone, ethinyl diacetate, norethindrone, norgestrel, megestrol acetate. So, these are the compounds that have biological activities similar to your progesterone. So, progestins and progesterone promote the development of secretory endometrium that can accommodate implantation of a newly formed embryo. So, examples of your progestins are your progesterone, norgestrel, norethindrone, megestrol acetate, and your ethinyl diacetate. So, the exception here is your testosterone. Number 79. Aspirin is to salicylic acid. Morphine is to heroin. So, aspirin is your acetyl salicylic acid, the product of the acetylation of your salicylic acid, and your heroin is your diacetyl morphine, the product of the acetylation of morphine. Okay, let's repeat. Aspirin is the chemical name of acetyl salicylic acid, which is the product of the acetylation of salicylic acid. Your heroin chemical name, diacetyl morphine, the product of acetylation of morphine. Okay, number 80. The functional group in pyridoxine is your alcohol. Pyridoxine is chemically known as 6-methyl-3,4-pyridine dimethanol. 6-methyl-3,4-pyridine dimethanol. And the functional group present in your pyridoxine is your alcohol. Okay, number 81, ascorbic acid and tetracycline are enols. So, enols, ascorbic and tetracycline are enols. Letter A. Number 82. MAO is classified as, your MAO is your monoamine oxidase. They are classified as an enzyme. So, monoamine oxidase, it is a mitochondrial enzyme found in neural and other tissues such as your gut and liver. So your MAO are found in your gut and liver. Number 83, when used in pharmaceutical preparation, the purpose of hydroquinone, lecithin in alpha tocopherol is as oil-soluble antioxidant. So, the purpose of hydroquinone, lecithin, and alpha tocopherol is oil-soluble antioxidant. Number 84, naturally occurring alkaloid derivatives of tropane are bronchodilator. Your tropane derivatives are anticholinergic and are used as bronchodilator. Number 85, local anesthetics that is not a derivative of benzoic acid is lidocaine. So, your procaine, your dibucaine, and your bupivacaine is a derivative of benzoic acid, and the exception is your lidocaine. 86. All of the following are macrolide antibiotics except your vancomycin. So your vancomycin is a tricyclic glycopeptide that inhibits bacterial cell wall synthesis. So the mechanism of action of your vancomycin is to inhibit the cell wall synthesis of the microorganism causing that certain disease. And it is a tricyclic glycopeptide. Your erythro, your oliendo, and your spiramycin are macrolide antibiotics because they have the lactone ring. Other examples of your macrolide are your erythro, your azithro, and your claritro. And of course, yung nakalagay dyan, your oliendo and your spiramycin. Okay, I repeat, your vanco is a tricyclic glycopeptide. Number 87. Ativan has this generic name, lorazepam. So, generic name, lorazepam. Brand name, Ativan. This is a benzodiazepine used as anxiolytic. So, your Ativan or your lorazepam is primarily used as anxiolytic. Number 88, Plasil is a metoclopramide. So, metoclopramide, brand name Plasil, highly effective at high doses against emetogenic cisplasin, preventing emesis. So, generally, your metoclopramide is used as emetic. Brand name again, Plasil. 89. The principal hydrolytic degradation product of aspirin is your salicylic acid. The product of acetylation of salicylic acid is your aspirin, chemically known as your acetyl salicylic acid. Okay, number 90. Barbiturates containing a sulfur atom are usually ultra short acting. So, barbiturates containing sulfur are ultra short acting and they may be administered intravenously in aqueous solution for the induction of anesthesia. Examples of your ultra-short-acting barbiturates are your thiamethyl sodium, thiopental sodium, ayan, yun lang. Thiamethyl sodium and your thiopental sodium are your ultra-short-acting barbiturates. Number 91. Although the prostaglandins are hormone-like, they may closely resemble your lipids. Chemically, your prostaglandin resembles your lipids. Number 92. The onset and duration of barbiturate action is mainly a function of its lipid solubility. So your short-acting barbiturates are more lipid soluble than long-acting barbiturates. So I repeat, your short-acting is more lipid soluble than your long-acting barbiturates. Number 93. The prototype narcotic antagonist is your naloxone. It is used as the agent of choice for treating narcotic overdose. So your naloxone is your agent of choice for the treatment of narcotic overdose. So it is 7 times more active than your nalorphine, and it shows no withdrawal effects after long-term administration. Take note of that. Your naloxone is the agent of choice for treating narcotic overdose. And because it has no withdrawal symptoms even in long-term administration. Okay? Number 94. Lysergic acid diethyl lamide is an ergot derivative. Lysergic acid diethylamide is, or your LSD, is an ergot derivative. So it does not occur in nature, but it is prepared by semi-synthesis, and it is derived from ergot, or the dried sclerosum of Claviceps purpurea. So the scientific name of your ergot is Claviceps purpurea. Number 95. Orthohydroxybenzoic acid is a salicylic acid. So it is a strong acid with antiseptic and keratolytic properties. So orthohydroxybenzoic acid is a salicylic acid with antiseptic and keratolytic properties. Number 96. Diamox has a generic name of acetazolamide. Okay. Generic name of acetazolamide. Number 97. Diphenoxylate is a structural analog of meperidine. So, diphenoxylate is a structure analog of meperidine. Okay, number 98. Cevitamic acid is ascorbic acid. So, frequently administered with methenamine to improve the effectiveness of this antibacterial agent, because ascorbic acid increases the chelation of iron by deferoxamine. It is used in the treatment of chronic iron deficiency. So your ascorbic acid or cevitamic acid is administered with methenamine because your ascorbic increases the chelation of iron by deferoxamine used in the treatment of chronic iron deficiency. Chloroquine is the generic name of Aralen. Generic name of chloroquine. So your atabrine is brand name of your quinacrine. Your atabrine is the brand name of your quinacrine. Your artane is the generic name of brand name of trihexyphenidyl HCl. Your Aralen is the brand name for chloroquine phosphate, and your acineton is the brand name for piperidine. Let's repeat. Your atabrine is the brand name of quinacrine, quinacrine, quinacrine. Your artane is the brand name of trihexyphenidyl hydrochloride. Your Aralen is the brand name of your chloroquine phosphate, and your acineton is the brand name for piperidine. Number 100, Cantrex belongs to this type of antibiotics. So Cantrex is also known as your kanamycin sulfate. Generic name, Cantrex is the brand name. So this belongs to your aminoglycosides. Number 101, epinephrine is also known as your adrenaline. Epinephrine is also known as your adrenaline. It is initially isolated from the medulla of adrenal gland of animals used for food, and it is used for the treatment of heart block or circulatory collapse. So epinephrine, also known as your adrenaline, and it is used for the treatment of heart block and circulatory collapse. Number 102, 1,3-dimethylxanthine is your theophylline. 1,3-dimethylxanthine. Your caffeine is 1,3,7-trimethylxanthine. 1,3,7-trimethylxanthine, that is your caffeine. Your theophylline is your 1,3-dimethylxanthine. Your theobromine is 3,7-dimethylxanthine. And your aminophylline is ethylene diamine salt of theophylline. So let's repeat again. Caffeine is 1,3,7-trimethylxanthine. Theophylline is 1,3-dimethylxanthine. Your theobromine is 3,7-dimethylxanthine. And your aminophylline is the ethylene diamine salt of your theophylline. 103. Of the following penicillin congeners, the one with the broadest spectrum of action is Carbenicillin, letter C. So, penicillin congener, that is your carbenicillin, the one with the broadest spectrum of action. So, it is used against Pseudomonas aeruginosa. So, it has activity against Pseudomonas aeruginosa. Your Pen-V, your methicillin, and your carbenicillin and oxacillin are also penicillin congeners. However, your carbenicillin is one with the broadest spectrum of action against Pseudomonas aeruginosa. 104. Zantac is ranitidine. Zantac is ranitidine. Your cimetidine here, generic name for Tagamet. Famotidine is the generic name of your Pepcid or your H2 block. Pepcid H2 block, famotidine. Nizatidine is the generic name for your Accid, and your ranitidine is the generic name of your Zantac. So, these drugs are your H2 histamine receptor blockers. H2 histamine receptor blockers. Cimetidine, famotidine, nizatidine, and your ranitidine. Okay, 105. Cytotec is misoprostol. Misoprostol is your generic name for Cytotec. So, its primary use is gastric, anti-secretory, and gastroprotective effects when administered orally. However, some uses this to induce abortion. Okay, so Cytotec is the brand name of your misoprostol, and it's primarily used as gastric, anti-secretory, and gastroprotective orally. Okay, however, it is used as an abortifacient. Number 106. Mahuang is an alkaloidal amine. The entire plant or the overground portion of Ephedra sinica. Ephedra sinica is the scientific name of your mahuang. It is an alkaloidal amine. In Chinese characters, your ma here means astringent and your huang means yellow. So, together it is a yellow astringent. Okay. Scientific name, Ephedra sinica. 107. Procaine is an ester. Procaine is an ester. So, all local anesthetics consist of hydrophilic amino group linked through a connecting group of variable length to a lipophilic aromatic residue. So, an ester linkage is present in procaine. Number 108. The functional group found in codeine and scopolamine is ether. Scopolamine and codeine, functional group nila is ether. Yung procaine naman, functional group is your ester. 109, aureomycin is your chlortetracycline hydrochloride. So, chlortetracycline hydrochloride was isolated by Dugar from Streptomyces aureofaciens. Streptomyces aureofaciens. So, your chlortetracycline is also known as your aureomycin. 110. Bonamine is your meclizine. Letter A. Bonamine is the brand name for meclizine. So, moderately potent antihistamine used as anti-nausea in the prevention and treatment of motion sickness and treatment of nausea and vomiting associated with vertigo and radiation sickness. So, it is an anti-nauseant. And also for the treatment of motion sickness, nausea and vomiting associated with vertigo and radiation sickness. Number 111. Polyene antibiotics include your nystatin and your amphotericin B. So, your amphotericin B is isolated from Streptomyces nodosus and your nystatin is isolated from Streptomyces norsei. So, they are polyene antibiotics. Letter C. Number 112. Among the three xanthines, it is the drug of choice for obtaining a stimulating effect of the CNS, that is your caffeine. So, your caffeine is used as a CNS stimulant. Your theophylline also is also used as a CNS stimulant. However, your caffeine is the drug of choice. So, caffeine is the drug of choice for stimulating effect of the CNS. 113. Your theobromine here has a little CNS activity. Number 113. A polysaccharide that is used as plasma expander is your dextran. Plasma expander, memorize, plasma expander, dextran. Lumabas ito sa pharmacognosy. Polysaccharide that is used as plasma expander is dextran. So, your dextran is a polyglucan that is formed from sucrose by the action of transglucosylate enzyme. Your dextran sucrase present in leukonostoc mesenteroides. So, it is used as plasma expander in cases of shock or pending shock caused by trauma, hemorrhage, or severe burns. Number 114. The combination type oral contraceptive pill contains your estrogen and progestin. So, they are the most common type of pills. Estrogen and progestin. 115. Simethicone is chemically classified as silicone. So, again, your pharmaceutical use of your simethicone is anti-foaming agent and the pharmacologic use is anti-flatulent. So, and it is chemically classified as a silicone. Okay, 116. An acidifying agent employed in effervescent salts and refrigerant drinks, tartaric acid. So, your tartaric acid is an acidifying agent employed in effervescent salts and refrigerant drinks. (117) This is an analgesic agent that is used to lessen severity of labor pains in obstetrics. Is your Demerol. Demerol, generic name, meperidine hydrochloride. So, Demerol, it is an analgesic used to lessen the severity of labor pains in pregnant women. Generic name, meperidine hydrochloride. Demerol hydrochloride. So, why? It is the drug of choice as compared to morphine and codeine because it shows little tendency towards hypnosis. Okay. Number 118, benzaldehyde is synthetic bitter almond oil. So, benzaldehyde is synthetic bitter almond oil. The ring common among penicillins and cephalosporins is your beta-lactam ring. So, the cephalosporins are closely related structurally and functionally to penicillins. So, the most common ring is between penicillin and cephalosporins is the beta-lactam ring. 120, retin A is tretinoin. So, retin A is the brand name of your tretinoin indicated for the treatment of acne vulgaris and initially used systemically. Okay, retin A, brand name for tretinoin. 121, barbiturates with an intermediate duration of action is your amobarbital. So, for short duration of action, the duration of action is less than 3 hours. For short duration action, the duration is less than 3 hours. Examples of your short is pentobarbital and your secobarbital. So, take note, short duration, less than 3 hours, pentobarbital and your secobarbital. For intermediate duration naman, the duration is 3 to 6 hours. Examples is your amobarbital and butarbital and your talbutal. ABT, amobarbital, butarbital, and talbutal. Long duration of action, 6 hours or more. That is your barbital, phenobarbital, and metharbital. So, let's repeat. Short duration, less than 3 hours, pentobarbital, and secobarbital. For intermediate duration of action, duration is 3 to 6 hours. Examples, amobarbital, butarbital, and talbutal. Long duration, more than 6 hours, barbital, phenobarbital, and metharbital. So, your intermediate duration of action here is amobarbital. That is amobarbital, not amorbital. Number 122, vitamin C is extremely important in wound healing. Its principal effect is on collagen formation. its potential is on the formation of collagen. Number 123, CNS depressant with skeletal muscular relaxant property except letter E, meprobamate. So your carisoprodol, methacarbamol, your baclofen, buspirone are CNS depressants with skeletal muscular relaxant property. So CNS depressant plus skeletal muscle relaxant. That is carisoprodol, methacarbamol, your baclofen, and your buspirone. So the exception here is your meprobamate. Okay, 124. The drug of choice for the treatment of genital herpes being potent against DNA formation is your acyclovir. So, the DOC for treatment of genital herpes is acyclovir. Acyclovir. Take note of that. 125. The most effective against malarial parasites in the liver but not effective against parasites within erythrocytes, that is your primaquine. So primaquine is most effective against malarial parasites in the liver but not effective within erythrocytes. So yung chloroquine naman, it is effective against parasites within your erythrocytes. Okay. 126. Feldin is a brand name for piroxicam. Feldin is the brand name for piroxicam. 127. Voltaren is diclofenac. Voltaren is diclofenac. So Feldin is the brand name for piroxicam. Your Voltaren is the brand name for diclofenac. 128. Depo-provera is medroxyprogesterone acetate. Depo-provera is medroxyprogesterone acetate, and it is used in the palliative treatment of, what is that again? Saan na yun? Endometrial cancer. So Depo-provera is used as palliative treatment for endometrial cancer. (129) Which of the following actions of histamine is not blocked by H1 antagonists? Is to increase in gastric secretions. So, the action increase in gastric secretions belong to your H2 receptors, which stimulates the gastric hydrochloric acid secretion. Your H1 antagonist increases salivary excretion, vasodilation, and itchiness. No. Baliktad. H1 antagonists block these actions. So, ang effect niya is to decrease salivary excretion, vasoconstriction, and prevent itchiness. So, your H1 are your antihistamines. So, yung H2 naman, Yung blinablock niya is yung gastric stimulate niya pala. Yung H2 stimulates gastric HCl secretion. Okay? Magets ba? Yung H1 antagonist, blinablock niya yung action na increase salivary excretion, vasodilation, and itchiness. Number 130, opium is an example of narcotic analgesic. So, opium is an example of narcotic analgesic obtained from Papaver somniferum. So, your opium is isolated from Papaver somniferum. 131. Which of the following penicillin derivatives is both acid-stable and resistant to penicillinase? Is your oxalin. So, oxalin sodium is the salt of a semi-synthetic penicillin that is highly resistant to inactivation by penicillinase. So, the answer here is oxacillin. 132. A diuretic that will manifest a competitive inhibition of the action of aldosterone is your spironolactone. So, your spironolactone inhibits the reabsorption of 2 to 3% of the filtered load of sodium at the tubule by competitively inhibiting the action of aldosterone. So, that is your spironolactone. 133. Sulfonamides are metabolized by humans principally by acetylation. Okay, 134. Streptomycin and other aminoglycoside antibiotics are ototoxic. So, the undesirable effects of your aminoglycosides, such as your streptomycin, particularly ototoxicity and nephrotoxicity. So, that is the undesirable effects of your streptomycin and other aminoglycosides. Ototoxicity and nephrotoxicity. 135. Benzalkonium chloride is a germicidal surfactant which rendered inactive in the presence of soaps. So, benzalkonium chloride is a cationic surfactant. They are inactivated by soaps and other anionic detergents. So, anionic plus cationic will render the activity inactive. 136. Acetazolamide or your diamox is rarely the drug of choice for diuretic therapy because it causes systemic acidosis and alkaline urine. So, your diamox is rarely the drug of choice for diuretic therapy because it causes acidosis and alkaline urine. 137. The antipsychotic drug loxapine succinate or brand name L'Occitane is a dibenzoxapine compound. So, your L'Occitane or loxapine succinate is an antipsychotic drug with a dibenzoxazepine compound. 138. Diphenolxylate or your Lomotil is an agent useful in the treatment of diarrhea. Diphenolxylate or your Lomotil is an agent used in the treatment of diarrhea, and it is structurally similar to your meperidine. So, meperidine and your diphenolxylate has the same structural analog. Okay. (139) Which of the following is classified as a broad-spectrum antibiotic? Is your ampicillin. Okay. Classified as broad-spectrum antibiotic is your ampicillin. Now, 140. Anti-manic agent is your lithium salts. Yan. Nulit na natin yan sa in-org. Your lithium salts are primarily used as anti-manic agents for the treatment of mood disorders. Also, it is used as a prophylactic to prevent occurrence of bipolar, manic, depressive illness. 141. Liquefied phenol USP is phenol containing 10% water. From the word liquefied, meaning meron siyang 10% na water. Phenol containing 10% water is your liquefied phenol USP. 142. Castellani's paint is carbol fuchsin solution. Your Castellani's paint is synonymous to your carbol fuchsin solution. Letter B. 143. This is an effective antidote for the treatment of poisoning by copper. That is your penicillamine. So, the antidote for the treatment of copper poisoning is your penicillamine. Tetracycline is a broad-spectrum bacteriostatic agent. Letter B. Tetracycline is a broad-spectrum bacteriostatic agent. 145. Which of the following is not soluble or miscible with alcohol USP is your acacia. So, acacia is insoluble in alcohol but almost completely soluble in twice its weight of water at room temperature. So, let's repeat. Acacia is insoluble in alcohol but almost completely soluble in twice its weight of water at room temperature. 146. The drug used in all types of tuberculosis is isoniazid. So, the drug used in all types of tuberculosis is isoniazid. So, it is considered to be one of the primary drugs for the treatment of tuberculosis. 147. Levarterenol or your Levophed is your levonorepinephrine. Letter B. Levarterenol or brand name Levophed is levonorepinephrine. 148. The most active aminoglycoside against Mycobacterium tuberculosis is streptomycin. So, your streptomycin is effective against tubercle bacillus or your Mycobacterium tuberculosis. Number 149, the most effective agent in the treatment of Rickettsia, Mycoplasma, and Chlamydia infection is your tetracycline. Tetracycline, letter B. So, tetracyclines are broad-spectrum antibiotics, and they are active against gram-positive bacteria, spirochetes, Mycoplasma, Rickettsia, and Chlamydia. Okay. 150. Aluminum and calcium salts inhibit the intestinal absorption of which of the following agents? Your tetracycline. So, stable chelate complexes are formed by tetracyclines with many metals. This includes your calcium, magnesium, and iron. So, such chelates are very insoluble in water, accounting for the impairment in absorption of most tetracyclines in the presence of milk, calcium, magnesium, aluminum-containing acids, and iron salts. So, aluminum and calcium salts plus your tetracycline will result to the chelation complexes of your metals. Okay. 151. Which of the following penicillin is resistant to penicillinase is your dicloxacillin. So, dicloxacillin is anti-staphylococcal penicillin and is penicillinase resistant. So, dicloxacillin is an anti-staphylococcal penicillin and is penicillinase resistant. 152. The quinolone derivative effective against Pseudomonas aeruginosa is norfloxacin. So, norfloxacin is effective against both gram-negative Pseudomonas aeruginosa and gram-positive organisms in treating complicated and uncomplicated urinary tract infections and prostatitis, but not in systemic infections. So, norfloxacin is the safest drug in treating UTI for pregnant women. Okay. 153. Which of the following penicillins is resistant to penicillinase? That is oxacillin. So, oxacillin and dicloxacillin are anti-staphylococcal penicillin and is penicillinase resistant. So, dicloxacillin and your oxacillin are penicillinase resistant. 154. Rancidity of fats may be due to oxidation of double bonds. That is your letter C. Rancidity of fats may be due to oxidation of double bonds.